Hello everyone. Welcome to JFK University Medical Center Health Spotlight. I'm your host, Dr. Kishore Ratkalkar, pulmonary internal medicine physician, senior attending JFK University Medical Center, affiliated with Hackensack Meridian Health, in private practice for 36 years in Edison and Old Bridge, New Jersey. In this show, we'll be talking about medical specialists who will unravel to you the complex world of medicine and provide you with information you can use to improving or the betterment of your health. Before I start this program, I want to thank our sponsors, our JFK University Medical Center President and Chief Hospital Executive Amy Thornton and her JFK team for the support for this initiative, which is critical to our communities, especially the South Asian community. And also I want to thank Shri H.R. Shah and TV Asia for hosting. Thank you so much. At this time, I have an expert in autism because this is the Autism Awareness Month. I'm delighted to have Dr. Savitri Bandari, a pediatric neurologist. As you can understand, it's a very important field, and there are very few of them who are practicing this field of medicine. And her expertise goes into different fields of neurology, which includes from migraine headaches to seizure disorders to complex issues, including autism, which she has made as her subspecialty in the field of pediatric neurology. Dr. Bandari has been in practice for over 20 years. She is highly acclaimed physician. She is board certified physician in the American Board of Psychiatry and Neurology. And I want to welcome Dr. Bandari.
Thank you for having me.
We will focus today on autism. Autism is something which is not well understood in our communities, especially when we look at children who are below 3 years old or those who are moving ahead. We see this in our schools. We see that the schools are not as proactive, I think they should be, in autism and finding problems in children before it becomes too severe. So can you explain to our audience and our viewers, what is autism?
So autism spectrum disorder is a complex neurodevelopmental disorder that affects communication, social interaction and behaviors. There are so many different types of symptoms, so not every child is going to present with same symptoms or signs. At the same time, it is not the same severity in each child. So when you take two children with autism spectrum disorder, they can be totally different. So that's why the term spectrum is there. So there are different severity, different combination of symptoms. In the same child also, it changes as child ages. So symptoms can change. So the first case of autism spectrum disorder was diagnosed in 1943.
Okay.
Initially, they used to call it as a childhood schizophrenia or infantile autism.
Okay.
And then later on, lot of changes happened, and then now the current term, umbrella term, is autism spectrum disorder.
Okay. Now, when we go, we'll talk more about this. There is a syndrome called Asperger syndrome and autism spectrum disorder, ASD, as you are saying it. What is the difference between the two? Are they same?
Good question. So we use DSM criteria, which is Diagnostic Statistical Manual for Mental Disorders. It gives the list of all common symptoms and signs that helps healthcare professional to make the diagnosis. So there are different versions. Right now we are on DSM-5. So before 2013, we were using DSM-4. And as per DSM-4, there used to be 3 different diagnoses. They should make different criteria for that. So one is Asperger syndrome, when child doesn't have any speech delay. He's kind of
normal-looking child,
intelligence
yeah.
and very few symptoms.
Right,
So
right.
those would give the diagnosis, get the diagnosis of autism spectrum. If child has some developmental delay, speech delay, cognitive delay, and he's like a little bit functioning wise, like he needs lot of help, then they would give diagnosis of autism.
I see.
If child symptoms doesn't fit in Asperger or autism, they would give the third diagnosis, which is PDD NOS, which is pervasive developmental disorder not otherwise specified. Then they revised this criteria and they made all these things together and they gave the one umbrella term, autism spectrum disorder, which is as per DSM-5, which we started using from May 2013.
Okay.
And we're still using DSM-5.
Okay, that's great. Thank you for that. So this Asperger's syndrome, we can just go through life not knowing you have it. Is
Correct.
that a fair statement?
Correct. If it is, many children go undiagnosed for a long time because it is not very obvious.
Right.
They are intelligent and they functioning wise, they don't need lot of help.
Right.
And nowadays, because of more awareness of autism, even people with 30s and 40s, they are getting diagnosed with autism spectrum disorder.
Because they're functioning fine
Exactly.
until you know, is it a comorbid with anxiety or OCD or something like that? It's very difficult to make a diagnosis.
Right.
Thank you for that. So let's go and focus on what are the causes, because there is so much literature out there and there is no specific entity where I could say from genetics to whatever as to these are the causes. Can you tell us more about the causes of ASD?
Sure. So the research suggests that it is genetic and environmental combination. So
Okay.
genetic, because why do they think it is genetic? If one child in the family has autism, his siblings are at risk for 7% to have autism.
7%?
7%. If two children in the family has autism, the risk goes to 35%.
Oh, wow.
And if there are like identical twins, they can have 36 to 95% risk to have autism. So that suggests strong genetic background.
So it's critical to make this diagnosis very
Absolutely.
early, because you'd identify those risk factors which have a significant impact.
Yep. As per CDC 2020, 1 in 36 children can have autism. And
1
it is
in
more
36.
common in boys, 4 times more common in boys than girls. So these
wow.
that suggests genetic background for this autism
So the risk
spectrum
factors,
disorder.
as you said, is genetics and environmental.
Yeah, so we talked about genetic, now it is environmental factors.
Okay.
So advanced parental age. So if mother is more than 30 and father is more than 40 at the time of conception, that increases the risk for autism. Then maternal exposure to medications, drugs, smoking, alcohol or viral infection during pregnancy, those are also risk factors.
Okay.
Then gestational diabetes mellitus has 2-fold increase with autism spectrum disorder.
Okay.
And maternal stress is strongly associated with neurodevelopmental problems, and autism is one of them. Then premature birth, low birth weight, any complications during pregnancy like complicated birth, child has cord around neck, he did not cry right away, or he swallowed fluid which is meconium aspiration, or he needed resuscitation, whatever the causes which causes oxygen deprivation for the brain, those are the risk factors. And once child is born, in early brain development, if there are any viral infections or pesticide exposure, those are also put child at risk to have autism.
Okay.
But these are all associated things, not the single cause. That's
Okay.
why it is a complex, multifactorial genetic and combination background.
Thank you. It's time for a short break. Don't go anywhere. We will be back shortly. Welcome back. We are here with Dr. Bandari, our pediatric neurologist, discussing on autism. And now the next question that I have for you is who this finding patients or kids or children or adults with autism, who is the right physician who should evaluate and make that diagnosis, because it's very conflicting, whether it is the primary care doctor, whether it's the pediatrician, whether it's a neurologist, whether it's a psychiatrist. The domain is so large and the spectrum is so large, and it's difficult to say, hey, you're the doctor who should call the shots, or you are the physician, or you are the psychologist, you are somebody, or you're a school teacher for that matter, who can be looking at this and making that call.
Yes.
So can you help our viewers as to, if they see a child, their child, who is having some issues, who should be the gatekeeper to initially evaluate autism?
Yes. So trained professionals like developmental pediatricians, some child psychiatrists, pediatric neurologists like me, neuropsychologist, and some psychologists can make the diagnosis. But autism spectrum disorder is a clinical diagnosis, so you can imagine it is very difficult to make the diagnosis.
Understand.
So some psychiatrists and some neurologists, they don't feel comfortable with the diagnosis.
Oh, I see. So what should the parents do? I mean, if say there is a child who is 3 years old or something and has all those things, attention deficits, social interactions are not there, or all those symptoms, the first segue to this is they should go to somebody in the school to help?
Not school. So pediatrician have some screening tools. They screen children at 18 months, 24 months. If child started showing any signs of autism, so they usually refer either developmental pediatrician or child psychiatrist or pediatric neurologist, whoever does the evaluation and the diagnosis.
So the first gatekeeper is a pediatrician?
Yes.
Okay, that's what I was driving
Yes.
at, to where we should go if we see a child who has shown some signs of autism and you're not sure, you should go to your primary care pediatrician, who will be your gateway to all
Correct.
others.
Correct.
Thank you for clarifying that. That is very important for families to know.
Yeah.
How do you really make this diagnosis, and what tests do they need to arrive at this diagnosis?
So autism spectrum disorder is the clinical diagnosis. So there is no blood test, no brain scans like CT scan, MRI, no EEG, which is electroencephalogram or brainwave study. So it can be very challenging to make the diagnosis of autism because you have no tests available. But when patient comes to us, so we get detailed history, starting with the pregnancy, like any pregnancy complication. We talked about the risk, so we have to figure out if there is any risk associated with that. Then child's birth history, then developmental history, is he hitting all the milestones or not, then family history, because it has strong genetic component and sometimes co-associated conditions also we can get some information, so detailed family history. Then we have to observe child's behavior, get all the history, symptoms, symptomatology. Based on child's age, we gather some information either from early intervention program, therapists, or daycare or schools. And with all these things we put together, and we also have some questionnaires and assessment tools which we use, and after doing all this comprehensive evaluation, we come up with the diagnosis of autism spectrum disorder. But it is a very challenging diagnosis.
Okay, I'll just move away a little bit from here. If a child is identified in a school with autism at a very young age, or say the kindergarten teacher says that this kid is, I think they should escalate at that point to IEPs, where the child gets the support that the child needs because the child doesn't fit in the class. So I'm seeing that there is a delay in getting this independent evaluation and placement for the kids who have behavior disorder, not because of anything but because of autism. I think that's something that a parent should take that initiative and they should interact with school teachers at a very early age, and they should be aware that these symptoms are right in front of you, and you're looking at your child who's a little different than others and who is a little challenged, and it is the time for you to the school district and say to start evaluating this kid or a child for IEPs or special support, which will go a long way in their process of treating autism. Having said that, what are the signs and symptoms that we should be looking for in an autistic child or autistic adult?
Yeah. As we mentioned, it is the spectrum, so there are so many different symptoms and signs we can think of. So they categorized under social communication problem and repetitive behaviors and some sensory issues. Just and some examples, for example, child doesn't have good eye contact, so either he's like fleeting eye contact
Right.
or no eye contact. Then they don't use pointing to communicate
Right.
what they need.
Right.
Then they can have speech delay. It is not necessary to have speech delay, but if it is a speech delay, then again it impacts on the communication.
Understand.
Then they are always in their own world, like social interaction,
Correct.
so they are not easy to interact with other children. Sometimes they go and sit next to the child but not playing with the child, so that is called as parallel play. So even though it seems like child is playing with other child, but he's not interacting
Not
that much.
interacting, okay.
So he can be aloof, going in the corner in his own world.
He's withdrawn.
Even exactly, so not connected with the surroundings. So
Correct.
people are more aware of this type of social interaction, but there is a other aspect of autism also. So child is too social, so he goes to strangers, he doesn't know where to stop. He
Right.
can go to strangers sit on his lap, touch his face, and if that stranger says okay let's go, and then he can go. So that can be dangerous. So those
Wow.
kids get late diagnosis because many parents are aware autism is socially distant, but it can be either direction also. And they also have they don't have joint attention. For example, for small kid, if you show something, look at the butterfly or something, child is going to look with a curiosity. Child with autism, he's not interested, so he's not even going to look. So we call it as a joint attention. They need everything very structured, same thing every day, same food, same clothes, and then same blanket or same towel or something like that. If small change, they cannot take it. So they also have trouble transitioning. So it is switching from one thing to another is very difficult. They become restless. Then they don't have safety awareness because they are not connected with the surroundings. So they can run on the road, or if door is open, they just run out of the house or something, elopement. So that is also can be risky for that. Then next is a lot of repetitive behaviors.
Mm-hmm.
So they, if you talk about speech, so they do
Right.
echolalia. So if you ask how are you, they will repeat how are you. If
Correct.
you say are you hungry, instead of answering they will say are you hungry. It's
Right.
like a parroting thing. And their speech can be very monotonous. There is no intonation or something, so monotonous speech. Then they might have a lot of sensory issues. Sensory means touch, pain, temperature, food textures, cloth textures. So sensory things can be undersensitive or oversensitive. Undersensitive means example is high pain tolerance. They are bleeding but they don't even cry, or they don't show any emotions. On the contrary, they can be covering their ears for just day-to-day sounds like toilet flushing, vacuum cleaner, pressure cooker. They cannot tolerate that. They need to smell food.
Right.
And the sensory issues for the food textures, and then cloth textures.
Okay, thank you.
And then toe walking.
Okay,
and
so
doing
there's
same
all
thing.
a lot of symptoms
Yeah,
there.
head banging, body rocking,
I understand.
spinning,
I
hand
understand.
clapping. So those are all behaviors.
Thank you so much. So it's time for a short break. Don't go anywhere. We'll be back shortly. Welcome back to JFK University Medical Center Health Stop. I'm here with Dr. Bandari, a pediatric neurologist. The topic today has been autism. And as we continue, Dr. Bandari, thank you for being here with us. What is the next step after the diagnosis of autism?
Yes. So after we make the diagnosis, child needs school placement and therapies. Again, it goes with the age. If child is from 0 to 3 years, he will get therapies through early intervention program. So this is a state funded program. They go to child's house and evaluate and give the therapies. And if child is more than 3, then he can have like special education class and then get all the therapies. So there are a lot of therapies available, like speech therapy, occupational therapy, sensory integration therapy, physical therapy, then behavioral therapy, ABA therapy, which is very gold standard therapy for autism, which is applied behavioral analysis. And there are music therapy, hippotherapy, which is the horse riding therapy, and then there are some PEC system, picture exchange communication system, for especially with minimally verbal or non-verbal kids. So they used to use flashcards, but now with more technology we have apps and iPads, and there are speech generating ACC devices also. So there is like a lot of all these aids are available.
That's fantastic. Dr. Bandari, now that we have discussed the diagnosis, what is the next step, the next most important thing that we need to know, is there really a cure for autism?
That's a very good question. I always get asked this question in my clinic also. So there is no cure for autism. It is a lifelong condition, but even though there is no cure, but with lot of like early diagnosis, early intervention with the therapies, there is a like lot of improvement in child's quality of life.
So there is really no cure, but all the modalities that you talked about, that will help in a long way.
Exactly.
So there has been a lot of myths, misconceptions of autism. You know it's out in in social media,
Yes.
newspapers, TV, etc. Can you elaborate on that?
So the first important myth is autism is caused by vaccines, so which is a big myth. In olden days, once theory came in the publication, and it said like there is an association of autism with vaccines, but later on there are numerous scientific studies came up and there is no link between autism and vaccine. So I recommend vaccinate your children, so there is no association of autism and vaccination, irrespective of whether it is a MMR vaccine or any vaccine. So vaccine has no connection with autism.
So these COVID vaccines, everybody has been talking about it, that it causes all sorts of things. Is autism also included in that misconception?
I think so, because we don't have enough studies for COVID vaccine because it is very new.
Right.
Yeah, so the second myth is autism is caused by bad parenting. So in olden days, there was one false theory which is called as refrigerator mother theory. So they would think autism is caused by cold and unnurturing mother. But later on, this theory was theory proved to be wrong. So autism is not caused by bad parenting. So autism is because of the combination of genetic and environmental factor, and it has nothing to do with parenting.
Oh, that's a good one to know, because otherwise we start blaming parenting as one of the causes other than other than vaccines and all other things.
So the next is chelation therapy.
Okay.
Lot of parents come and ask me I heard there is a chelation therapy for autism. Chelation therapy means removing heavy metals like lead, arsenic, zinc from your system. But the scientific studies shown that it has no effectiveness in autism. On the contrary, it can cause cardiac failure, kidney failure, and in certain cases death also. So this is not the standard therapy for autism spectrum disorder. Next thing is stem cell therapy. I have some patients who are going out of America and then getting those stem cell therapy done. So it is essential to note that stem cell therapy is still experimental therapy. It is not approved as a treatment. We do not have enough research or evidence that stem cell therapy is effective. So it is still experimental in nature.
So it's not really a standard treatment protocol.
Also, there are some hyperbaric oxygen therapy,
right.
Then GFCF diet like gluten-free, casein-free diet, vitamin B12 injections. All those do not have sufficient scientific evidence. So those are just there. So
the standard scientific evidence is what you are practicing.
Yes.
And anything which is not there is just hearsay.
Yes.
It's anecdotal that somebody got better and whatever.
Mm-hmm.
I get that. Thank you for explaining all that. Are there any medications at all for autism?
Yeah. So there is no such medication for autism, but we can address some core symptoms or some co-associated conditions like anxiety, depression, obsessive compulsive disorder. In 20% of cases we see epilepsy like seizures, and then we have to treat them with the medication. Sleep disorders also very common, and in more than 90% of kids they will develop ADHD, attention deficit hyperactivity disorder. They might need medication. So unless there is some comorbid condition or symptoms, for example aggression or something, it is out of control, then we use medication, but there is no medication for autism.
There is none.
None.
So when you have comorbid conditions like say severe anxiety, severe OCD, etc., and then the ASD spectrum, that is challenging.
Absolutely.
As to what you treat and how you treat it, and what about the other, your CBTs, your behavior modification and all that come into play.
Yes.
So I find that very challenging to the patient, to the family and the caregivers. Absolutely. As to how you go about managing this disorder. The thing that is important for our viewers to know about autism is, what is your take-home message today that they should be aware of and that they should look at. Yes. And be aware of autism?
Yes. So take-home message for the patients or whoever listeners. So first thing is, learn more about autism spectrum disorder so you can help your family members, relatives, friends, or even co-workers. When you notice some red flags in your child, please take your child to the professional for the evaluation and diagnosis, because timely diagnosis and proper placement in school and receiving therapies, that makes the big magic. Vaccinate your child, because we just talked about vaccination has nothing to do with autism, so there is no link associated. And autism is not because of bad parenting, so do not blame yourself or do not blame anyone. And taking care of child with autism is very stressful, so other families or other people also, they should not isolate these families and they should morally support them. So the lastly, early diagnosis and timely interventions are key for the autism spectrum disorder.
Dr. Bandari, this was a very informative session, especially for our viewers. It was excellent knowledge that we have all gathered from you, and I'm sure all of us are grateful and thankful to you for a wonderful discussion on autism spectrum disorder. Thank you for being here with us. Thank you.
Thank you so much for giving me this opportunity. Thank you.
Appreciate it. Thank you.